For the second time in 2 years, the World Health Organization is declaring MPOX a global public health emergency.
Health and wellness reporter Lauren Petty is joining us here with much more on this. Lauren?
Now, big news out today. This all stems from an outbreak in Africa that spread from the Democratic Republic of Congo to neighboring countries. The last global public health emergency was issued just in 2022. That's when nearly 100,000 people were affected here in the U.S. And again, you may remember Chicago did experience a surge in MPOX cases. Now, symptoms for MPOX include a rash and a flu-like illness. MPOX is spread through physical contact, such as shared clothing, towels, even utensils, and the illness can last 2 to 4 weeks. The Chicago Department of Public Health continues to monitor cases, and online data shows a total of 20 cases reported in the city of Chicago in the last 3 months. Now, there's also a warning from the CDC today, and that's about another virus. This one is most often seen in children, but can have serious consequences for pregnant women. It's called parvovirus B19 or parvo B19. The CDC is reporting an increase in cases in kids ages 5 to 9. While some only experience minor symptoms, the virus can be dangerous for those who are anemic, the immunocompromised, and pregnant women.
And the big risk to the fetus is the same thing we see with other high-risk groups. So they decrease their red blood cell production. They get anemic very quickly. That can lead to some really serious problems like fluid collection around the heart and the lungs, and actually up to death in up to 5% of fetuses whose moms get this.
Now, symptoms for parvo B19 include fever, headaches, muscle aches, and joint pain. And about a week after infection, some people develop a very distinct face rash. It's also why the virus is also called slapped cheek disease. It's very red. When that rash appears, you're likely not contagious anymore, but that's nearly 1 week in, which is why doctors say you should keep sick kids, anyone who's sick with a fever, at home, especially, again, as classes are getting back in session. And finally, if you feel like your body is just breaking down as you get older, new research may explain why. By analyzing blood samples, Stanford researchers found that molecules and microorganisms in the body go through 2 periods of rapid change in our mid-40s, about 44, and in our early 60s. Now, the changes seem to have a big impact on metabolism. Study authors told NBC News it's not that people in their 40s are burning calories more slowly, it's that the body is breaking down food differently. So researchers say this all points to the need for healthy habits, especially in our 40s and again in our 60s, maybe throughout. Regular exercise, including strength training, and even decreased alcohol consumption to all cope with those metabolism changes.
So skip the glass of red wine at night and chocolate and...
There's all these studies that say different things, but again, interesting that they can actually pinpoint, right, the molecules and the microorganisms. So I think, again, this is probably the tip of the iceberg. More study will need to be done, but it's really happening. If you feel like you're aging and it hurts, there's a reason for it.
Listen to your body.
Science. All right.
Thank you.
You're
Thank you,
welcome.
Lauren.